Hi everybody, just thought we'd give you a quick update where we're up to. It's the end of April 2020, we're in the middle of this COVID pandemic and it's been a busy and difficult month for all of us really, for the patients that I've been in touch with, for the team and for myself, working hard. It's been quite brutal. What's happened in April, we've had the Easter bank holiday, which was lovely sunny weather for a bank holiday. Unfortunately, some of the team were having to work over the weekend with their NHS roles, and I worked over the weekend, but it was nice to have some time in the garden in the sunshine. Team are all doing well. We've got Gavin, who's moved to the medical acute wards in Arrow Park Hospital. We've got Cleo, who's working with the early support discharge team, which is the stroke rehab team at Clatterbridge. She's doing phone calls and remote video calls to support the patients there, the stroke patients that have all been discharged home but are requiring ongoing input from the rehab team. So Claire's doing a great job there with the ESD team. We've got Lauren still at the Countess Hospital, working in acute and medical and ITU, doing a great job. We've got Sean and Kitty have now furloughed, as has Hayley. I'm still seeing a 3 or 4 patients in the community. I got into touch with the Chartered Society of Physiotherapy, CSP, for some professional advice, because there's a few patients that fitted the category of people who might very well deteriorate and require a hospital admission if we didn't see them. So through phone calls and confirmation emails, I felt that the professional advisory officer there was very helpful. We identified 2 patients who they have complex mobility issues, are quite frail and are entirely alone. So I'm still seeing them, and 1 patient who has a traumatic brain injury, long-standing tracheostomy for respiratory issues, and requires physiotherapy to help him with his recurrent chest infections. So still seeing those 3 patients in the community. Had another patient who on the caseload who had a very unfortunate series of disc prolapses, lumbar spine disc prolapses, hospital admission, lots of pain, reduced mobility. So I've picked him up too, because he's just been recently discharged from hospital. So an interesting little caseload out there in the community. Patients are upset on the phone when we speak to them, when I speak to them, emotionally missing their rehab, feeling that they're deteriorating. Unfortunately, we've got 1 gentleman who fell and has broken his hip. Hospital admission, open reduction, internal fixation, surgery. I understand he's doing much better now. And a lady who fell and has broken her hemiplegic arm, unfortunately, and I'm told she's doing okay, but obviously what a nightmare. So yes, patients are struggling, but we're doing our best to support them on the phone calls and video calls as possible. So that's the team, that's what's ongoing. We're holding our nerve for the furlough pay, ready for the payroll at the end of April. So hoping that comes through, I'm sure it will. And we're hoping that we were very successful. We applied for the small business rates relief grant and we received that. So thank you very much, Rishi Sunak. That's helped with outgoings. Obviously our outgoings are still outgoing, so that's tricky. We're doing our best to bring in outstanding balances and maximise any income that we've got coming in, and Richard and I aren't taking any salary at the moment. And that's it, that's where we're up to. Been in touch a lot with BBTA. We've had a Zoom meeting with BBTA. We were planning towards our AGM, so the meeting that we've had to cancel in May is now happening over a series of Zoom meetings. So I've been closely in contact with Catherine and with Lynn Fletcher in Manchester and Mary Lynch-Ellerington in York and Helen Linfield down south, just keeping in touch with how their private practices are going, and the courses that we've had to cancel, and trying to be a resource for people if they need us. And that's really where we're all up to. As best as we can, we're doing our best, and thank you all so much for all the kind messages of support. It's been a difficult month, but if we can just keep going, we've got through the peak of the infection, so we're told, and we're hoping for better news in May, where we perhaps have some information about how the lockdown starts to ease. So that's where we're up to. Thank you very much, and keep in touch, keep safe. Bye.